No one really wants to know about us because nobody wants their loved one to have dementia.
You're getting clientele from different walks of life, different types of dementia. How do you group people together with similar types of dementia, or how is that all managed?
That a lot of family members, they want to do it themselves. They feel that they owe it to their spouse or their parent, and it feels kind of like an obligation, or they feel guilty hiring professional care. But we try to share with the families that it's really a gift.
When my husband visits his mother at a memory care, she is packing to go live with her sister. And he walks in, he said, "Mom, just wait. And, she's not ready yet. You just need to wait until she calls you, and then you can start packing." You're juggling your kids, your job, your spouse, and you're realizing that your parents are aging. Maybe one of your parents or loved one has dementia, some sort of memory care deficit, and you're busy in your own life and you're just not sure what to do, who's going to care for mom, who's going to manage her finances, and who's going to pay for it all. So often people will look to in-home care, or they'll look to memory care outside of the home. But did you know that there's a third option? Today we have Lisa Tyburski. She's the Chief Marketing Officer at Glenner Centers. So welcome, Lisa.
Thank you. Thanks for having me.
So tell us a little bit about Glenner Center. This is an idea that a lot of people may not be aware of exists.
You're right. So we are an adult daycare, a nonprofit adult daycare. We run 3 adult daycares in San Diego, actually. One's in Encinitas, one's in Hillcrest, and one's in Chula Vista. We're Monday through Friday, specialized activities for people with dementia.
And what are their hours?
8:45 to 5:15.
I mentioned the hours. I think that's especially important because a lot of people have a regular job. They work 9 to 5, and so that allows families to drop off mom or dad or aunt or uncle, and they can still drop off their parents and get to work and have some freedom to have your life, and then still know that mom or dad is being taken care of.
Exactly.
So what happens when someone drops off their loved one at Glenner Centers?
So they'll drop off sometimes at 8:45. Sometimes we have people waiting in the parking lot at 8:30, and then sometimes they'll trickle in till, like 10:30. But when people come in, they usually have coffee, socialize, and then the activities begin around 10 o'clock, and they'll do puzzles, bingo, art, music. Sometimes we have guest speakers, guest presenters, guest performers come in. It varies every day. And then they'll have lunch, and then in the afternoon there's more activities as the day goes on.
So there are over 60 types of dementia. You're getting clientele from different walks of life, different types of dementia. How do you group people together with similar types of dementia, or how is that all managed?
We do. So we group people more by cognitive ability and likes and dislikes. So it's more based on their level of dementia. If people are more early stage, they'll be grouped with people that are more early stage. And if they're later stage, they'll be grouped with people that are later stage. And then we also take into consideration likes and dislikes. So regardless of the dementia, some people like art, some people like pet therapy, some people don't. So we take that into consideration before we group people in activities.
Can clients bring do you call them clients first off?
Participants, we call them participants.
You mentioned pet therapy. So where do the pets come from?
The pets come from the Humane Society, Helen Woodward, or Love on a Leash. Those are the 3 organizations that we primarily work with. And they bring in pets, cats, birds, dogs, periodically. They come in, a couple times a month. And then the participants are, again, grouped by whether or not they like pets. I mean, if we had somebody, allergies, right? Or if we had someone that was afraid of dogs or cats or didn't really like animals, then we wouldn't have them participate.
Okay, so it's like a certain area of the hall.
Right. Typically most people like it, so we do it in our park, in our Chula Vista Center. We'll do it in our park, and most people participate. But if they don't want to, they can sit out.
So I'm going to get straight to it with cost. What is the cost for this?
So the cost is $105 a day for a full day, or $75 for half day.
That's not a lot.
No,
actually.
It's really not. It's under $13 an hour. So that's why I'm so happy that you had me here today, just so we can share with people that there is a third option, because home care is amazing, but it can be very expensive. And assisted living, residential, can also be amazing and really helpful, but it's also very expensive.
Well, and then also, if somebody's not ready for mom or dad to go into a senior community, or the spouses, the couple is still together, and there's a lot of weight that goes on the caregiver. This gives them another option so that they can prolong their life and their health.
Right, and that's what usually people want. They want to stay living in their home. They want to keep their spouse or parent living in their own home. That's usually the goal first. They may need assisted living eventually, but not at first. And so that's why I'm so happy to share that there is this option, because people don't realize it. The other thing that the adult daycare programs work great for is avoiding crisis-driven decisions. And that's what usually happens with assisted living decisions. Not always, but sometimes people say, oh my gosh, there was a fall or somebody wandered outside of the house. And then they say, we need to pick a residential community immediately. And then they may not have time to do their research and find the perfect one. So if they send their loved one to one of our day programs, then they have a chance to just breathe and pause and really make an informed decision.
And they get a little bit of respite in the process.
And they get a respite. So that's the thing is that a lot of family members, they want to do it themselves. They feel that they owe it to their spouse or their parent, and it feels kind of like an obligation, or they feel guilty hiring professional care. But we tried to share with the families that it's really a gift. It's a gift for the person with dementia, because they're coming to the center, they're socializing, they're laughing, they're meeting people, they're having fun, right? So that's a gift for them. And then it's also a gift for them, because then the family member, the caregiver, is getting a break, and then they're going to be a much better caregiver at the end of the day, because all they need is a break sometimes. All they need is just a few hours.
And so you mentioned that how great this is. It's wonderful, the socialization. But the other side of it, honestly, is there's some people that have resistance. They don't want to go. They don't want to be social. But the adult children or the spouse needs that respite on that particular day. So what does that drop-off process look like for somebody who is resistant?
So that's common, first of all, and I would just, let families know it's very, very common. I mean, it would be normal for you or I if we were going somewhere new and, our spouse is forcing us to go there, or our adult child is forcing us to go there. There could be just resentment or resistance there a little bit. Yeah. And then let's face it, I mean, no one really wants to know about us, because nobody wants their loved one to have dementia. So we know this, right? So we know this going in. We also know that sometimes the person with dementia is being, persuaded by their family member to come. We also realize that. But usually what we tell the family is, don't worry, this is normal. We've got this. And we know what to say to the participant to encourage them to come in and just give it a chance. We assure them that they're not being dropped off, because that's a problem, is that they think they're being tricked and they're being dropped off at a residential place, and then someone's never going to come get them.
Yeah.
So we just assure them that someone is coming to pick you up at the end of the day. And then it usually works. We have really good success. Our caregivers are trained. Our caregivers in our centers, the professional ones, are all trained in dementia care and what to say and what not to say. The other thing that we do before people enroll is we get a biography form, and that the family member fills that form out, and it tells us what they like, what they don't like, things to say, things not to say that might trigger them in a negative way, right? So we learn all kinds of things about them, because the person with dementia can't always speak for themselves and share those kinds of things. So the biography is huge.
How many participants are there on a given day?
Encinitas is licensed for 30, and we have roughly 30 every day. Hillcrest is licensed for 24, and that center is actually pretty full. But when I say that, I don't want to discourage anybody, because of the nature of what we do. Openings always happen. There's turnover. Yeah. And then the one in Chula Vista, that's our newest and our largest, and that's licensed for 75 people, and we've got around 65 right now.
Okay. Yeah. And what's the difference between the three different facilities?
So they're very different from each other. The Hillcrest Center was our very first center, opened by Dr. Glenner and Joy. That's a small, that's the cottage.
Okay.
Yeah. So that's also nicknamed the Little Blue House. It's very near and dear to our hearts. It was because it was the very first one that opened in 1982. And it's a little blue house on the corner of 4th and Pennsylvania, in the heart of Hillcrest, Bankers Hill area. And again, it's a house. And so there's a dining room and a little kitchen, because the house is really old, which makes it really quaint and has a lot of character. And then there's a main activity room. So that's the small one.
You said it was opened in 1982. Do you know what year the house was built?
Oh gosh, way before that. I want to say the 50s.
Okay, just so it has that era,
yes,
that feel.
The 50s.
Okay.
It's really old. I mean, we've renovated it and we've updated the plumbing and we painted and things like that, flooring. But it's very quaint. It's really cute.
That. Before you explain the other locations, tell me why they started this, because you said that was the first house.
Yes, it was. So we do have a very profound founding in San Diego. So Dr. Glenner was a researcher and physician at UCSD, and he was primarily focused on research, but he was also a treating physician. And one night in the middle of the night, he received a frantic phone call from the husband of one of his patients. And he had a loaded gun, and he decided that his only solution to his caregiving stress was to murder his wife and commit suicide, which is horrible. And it just speaks to how stressful it can be to take care of someone with dementia. Yes. And it can go on for years, and people just get to a breaking point. So luckily, Dr. Glenner and Joy were able to stop that murder-suicide. But the next day, they said research is huge, and Dr. Glenner, fully continued on focusing on research. But they said we have to do something for these people now. We have to do something for the living. So they opened up that first daycare center in Hillcrest. And that's one of the reasons, too, as Glenner has gone on to build our Town Square Center, which I'm sure we'll talk about in a minute or two. But we decided to keep that one because it is so special, and it was the very first one. And sometimes people like the smaller center. They like that. So they opened the center in 1982, and then Dr. Glenner went on to discover the link between beta amyloid protein in people's brains and Alzheimer's. So he made a huge, huge discovery in the Alzheimer's field.
And then the Encinitas location?
And then the Encinitas location, that's located inside of a Silverado Senior Living building. We rent space from them. It's not a Silverado program, it's a Glenner program. They're great partners, but we just rent space from them. And again, that one's licensed for 30. And then the one in Chula Vista, again, is kind of our latest and greatest. Yes. That we opened in 2018. We had another center on the property of Frederica Manor in another part of Chula Vista, and that one was great, and that was licensed for 30 as well. But we wanted to build this bigger center. So that one is licensed, again, for 75 people. And it's built out on the inside like a small 1950s town to facilitate reminiscing. So we do reminiscence therapy at all of our centers, but we can kind of take it to the next level inside of Town Square because there's a 50s diner and an old-fashioned...
What's the name of that diner?
Rosie's. Yeah, Rosie's Diner. And there's a big movie theater and city hall and a pub with a pool table. So it's a lot of fun. So we can kind of take our reminiscence therapy to a higher level.
Is there music played?
There's music. Yep, there's always
from that
music.
Era,
it's from that era.
Okay.
Yep, it's from that era. And the reason we picked the 50s, early 60s is because the average age of our participant is about 80, 81. And studies have shown that, people will lose their short-term memory first, but oftentimes the long-term memory is left intact. And so it's our job, we feel, to pull that out. So we'll play music from when they were graduating from high school, getting married, having kids, and
Elvis,
those are the time.
Beatles,
Elvis, we've got some Marilyn Monroe, Sammy Davis Jr. So it's a lot of fun.
Good stuff. Hi, friends. I want to pause here and speak directly to the sons and daughters listening. If your parents' health is changing, if the house isn't supporting them the way it used to, or if you're stepping into decisions you never expected to be making, you may be trying to figure out who should be helping you right now. Well, there's a lot of voices in this space. The key is knowing which one actually fits your situation, and that's where a discovery call can help. During that conversation, we look at your specific circumstances and get clear on what needs attention first. It's about helping you identify the right next step and the right professional for your situation, so you're not guessing or reacting or carrying the weight by yourself. If having that kind of clarity would steady things for you, you'll find the booking link in the show notes. Now, back to the episode. So, thinking about families, and they're looking for this respite, and there's then their parents or loved ones, their health starts to change. Their cognitive ability starts to decline. At what point are they no longer a fit for the adult daycare?
Yeah, so that happens. That's, obviously that's pretty common. And normally they would go to 24-hour home care or assisted living. And the reasons would be either their behaviors get aggressive or disruptive because it is a group setting. I mean, it's basically a senior center. They're all senior centers, but with a special expertise for people with dementia. So it's a group setting. So if someone had behaviors that are typical with dementia, so it's not, it's not to say that they're not common behaviors, but if they're aggressive or biting, pushing, shoving, our team or other participants, then we wouldn't be able to.
So how does the team manage that? If that situation occurs in the moment, what happens?
So if something was to happen while they're there, they would pull them aside and either put them with another group or, because there can be a lot of reasons for it too. So it could be medication interaction, it could be they had a bad night or something's going on in their life, or we put them in an activity that they don't like. I mean, that can happen. And then if we do that, we usually don't because we have that biography. But let's say they were with someone that they didn't like or whatever. So we would move them out of that situation.
Okay.
If it didn't change, we would call the family and have them come pick them up.
Okay.
But we wouldn't necessarily just immediately discharge them. We would work with the family and maybe their physician, because again, it could be a medication interaction. They could have a urinary tract infection, which is very, very common and can cause behaviors. That is something that a lot of families don't realize, that it could be a UTI. Very, very, very common. So what we would do is say, address that, and then we would give it a try. And that is one of our claim to fame, is we really try not to discharge people if we don't have to, but it's when it becomes unsafe for them or our team, or goes beyond the scope of our care, because we aren't an assisted living, we aren't a hospital, we aren't a skilled nursing facility, we're a daycare center.
Okay. And so what is the training of the staff? And then I also know you have volunteers.
We do. So our staff is trained, we have an education department, and they'll do extensive training on dementia care, and one of which is a dementia sensitivity course that our director of education actually designed, and she has everyone go through that. And then they do periodic trainings throughout the year, of course. But at the beginning, they do this dementia sensitivity class. We call it the Dementia Challenge, where we had to do it too. All employees have to do it, and it's really eye-opening, and it just simulates what it's like to have dementia. So you put earplugs in and blurry glasses, and we play really distracting music, and then ask people to do tasks, and then we realize ourselves as employees, care staff, how difficult it is to have dementia.
How irritable you can become just having those distractions.
We have done that class for many, many, many people, not just our staff, and it's really, it's wild to watch the people's reaction, because it's really irritating. And then at the end of it, our director of education will look at everyone and she says, well, that's exactly what it's like to have dementia. So that's why they're getting
education for the families?
We do. So we actually have one starting on September 25th.
Okay.
It's a 9-week series. It's at our Chula Vista location. So that is strictly for families, and it's from 10 to 2. So it's 10 to 2 once a week, I'm sorry. And then we also have a free respite care component of it too. So if someone qualifies, they can do the free respite. They don't have to enroll.
So it's 10 to 2, and you go once a week for 9 weeks? Okay.
Yeah. Yep. And so we'll do training for families. So that's the family caregiver program. And then we'll also do training for assisted living. That's a separate program.
I remember when I was part of the Caregiver Coalition here in San Diego, and I was at one of the trainings, and someone was teaching the audience how to redirect a loved one who has dementia. My mother happened to be a school teacher, and the example was for teachers. And so if your loved one says, I need to get up and go to work today, instead of saying, remember you don't work anymore, that could upset them because they don't remember that, and that's clearly why they said, I need to go to work today. So instead, you redirect them and you say, Mom, remember today's Saturday, you don't have school on Saturday. Or even somebody that's not a teacher, remember on Saturday, or it's a holiday, you don't have to work today. Just redirecting them, it's a white lie, but it's really to do good.
We do, yeah, we do a lot of that. So can you imagine, I mean, here's a scenario where, again, the average age of our participants is 80, 81, and they say, oh, I'm going to go visit my mother, right? Yeah. The mother passed away 20 years ago. And we say, oh no, your mom passed away. They relive the death as if it just happened today. And so then, let's say 20 minutes later, they ask the same question, and then you tell them again that no, your mom passed away 20 years ago. That does not do any good. So we normally would say something like, okay, sounds good. And we leave it. We're not going to challenge.
And they just move on.
And then they'll move on to something else. But why would you want to make someone relive something that's tragic like that, or try to correct them when it's really going to be futile?
When my husband visits his mother at a memory care residential care facility, she is packing to go live with her sister. And he walks in, he said, Mom, just wait. And, she's not ready yet. You just need to wait until she calls you, and then you can start packing. So he just redirected her instead of saying, you're not leaving here. Right,
because that's just very upsetting.
So that also brings me to guilt. A lot of family members feel guilty that this is the choice that they've made for their parents. how is there any sort of support groups or any sort of education or any really support in that area?
Absolutely. So in addition to those caregiver classes, which are twice a year, we have ongoing support groups. And people don't have to have a loved one at the Glenner Center to join. Some are in person and some are Zoom. So you really could join from wherever. The groups are specifically for people caring for someone with dementia. So that is that's the specific topics that come up. But, we also know, as I mentioned, that, people will come to us and they really don't want to be there. And they come in and they could be, arguing with a sibling or their other parent. The parent says, no, I'm not bringing dad to this. And the daughter says, yes, mom, you need to. So there's a whole range of emotions that go along with this decision. So our job is we welcome them. We let them know that we know what we're doing and that they'll be safe and they'll be supervised, they'll have fun, and that you're actually doing something for them that is a gift for them. And then again, as I mentioned earlier, it's a gift for the caregiver because they're not going to be resentful and angry that if you're doing it yourself 24 hours a day, you feel resentful. And then you feel guilty because you feel resentful. And you say, oh my gosh, I'm a horrible person. How could I feel resentful? This is my mom. Something like that.
So it's a natural feeling.
It's really natural because you have your own kids or you have grandkids and there's other things that you want to do and you're worried about your spouse or your parent. And so just bringing them to a day center for a few hours a day so you can get some other things done, you can rest, you can go visit with your grandkids, and then you pick your loved one up and then you feel better. You've done your thing, you're not as resentful, you're looking forward to seeing them, and then they still live in the privacy of their own home. So
how can the family stay involved in the initial days of them starting at the Glenner Center? So can they go in and sit with them for a little while until they're comfortable, really till the adult children are comfortable?
That's really
what's
actually
that
what
like?
that is. That's most
yes.
of it is that.
Yes.
So we get asked that a lot, and I understand. I mean, we do get that they want to come in, and we have a lot of people say, oh, she won't go in there unless I come in with her. But we really shy away from that because if a family member comes in, I hate to use the comparison to young, kids, but when you dropped your kids off at school, like you alluded to, and they're upset and they're making you feel bad. As soon as they're with the teachers, they're fine. So that's usually what happens. So it sometimes kind of has an opposite effect when the family member comes in. We usually just say, hey, we're going to walk them back. If you want to hang here in the lobby and we can update you in a few minutes and let you know how they're doing, that's more how we would handle it rather than having them come in, because then the other participants will be like, well, hey, I want my daughter to come too, So, and the whole idea is for the caregiver to leave. That's the whole idea, so that they can go rest or do what they need to do.
Do you have any advice for people who are trying to figure out this whole, really, it feels like a mess, because you care about your parent and you're working, you've got kids, you've got a busy life, and they're looking at all their different alternative options. So how do they know when the adult daycare is the right fit for them versus moving mom or dad? Because they might be considering, well, we're just prolonging the inevitable. Why not just move into a senior community or memory care now?
Well, and they can, like I said, the assisted livings are great and they serve an incredible purpose, but it's expensive and they may not be ready. They want to keep them at home. But I think the biggest thing to look for is, number one, is you really have to recognize the signs of caregiver stress. And a lot of people don't. They're like, I'm doing it, I'm good. They're tired, they're snappy, they're resentful, they're angry, they're lashing out, they're stressed, but they're also taking it out on their loved one. How can you keep losing these things? Stop asking me the same question. Right. But those are normal dementia symptoms. So they have to take a break. So I would say avoiding crisis-driven decisions. Don't keep doing it until someone falls or wanders and you have to call the police. I mean, those things happen all the time. But if you take more of a preventative approach where you say, okay, things are getting a little bit, you're unsure, you're starting to feel really stressed.
Or safety becomes
safe.
a factor.
You don't want to take a nap because you'll wake up and they might be down the street and, not able to find their way back. So a daycare center, at least in my opinion, it's such an amazing first step. It's an affordable first step. They don't have to come every day. Some people come 5 days a week, all day. Some people come 1 or 2 days a week.
That's good to know that they have those options for sure.
Oh yeah, they can come half days. Most people start with 2 or 3 half days just to get used to it. And then once they're in a routine, then they'll extend it and they'll stay full days.
Okay. So thank you, Lisa, for joining us today. Hopefully you got answers and you have a new option that you didn't know existed before, and that you can keep your loved ones safe and you can keep your sanity. Thank you so much for listening.